Tweakments to do in your 20s and your 30s. I'm Dr. Barrett, I'm board certified plastic surgeon, and I got a lot of people that come in at all ages, and I have people over the years that kind of do little maintenance here and there that kind of adds up and looks great, prevents like longer facelift surgery later on down the line. So I think in the 20s, less is more. The most amount of tweaking I would do is maybe a little bit of lip filler. I say a little bit of lip filler. A lot of women just get way overdone with the lip filler and it ages you. Don't do it, okay? 1 cc a year at most is probably all people need. If you have some other areas like retrognathic chin or jawline stuff you want to do, I think it's fine, but don't overfill the cheeks. Don't do the under eyes unless you have like a genetic predisposition for like hollowed eyes. But Botox, preventative Botox or Daxify, I think looks great for the skin long term and keeps areas looking pretty youthful. Now, as you get into your 30s, we start to see the volume loss, and that's shown in cadaver studies of where we lose mid-face volume, and that's a good time to kind of do some gentle filling in that area. Again, stay away from hyaluronic acid for those areas. I do more stimulatory fillers so you don't clog the lymphatics too much, so like Radius or like calcium hydroxyapatite or Sculptra, and those tend to kind of build natural collagen so you don't get as much of that hyaluronic acid, which is like a clear kind of boggy looking effect. You could use a little bit, but like don't do too much because it ends up looking kind of waxy on the cheek area. You also may want to start looking at the temples if those are getting hollower, but that's typically not until your 4th or 5th decade that you start to see that. Now you want to start getting to more skin modulating therapy like microneedling as well as CO2 laser, but microneedling with exosomes is kind of my go-to once you're in your 3rd decade. Continuing the Botox as well, light filler here and there is okay, but again, you don't want to overdo it. And of course, any age is skincare. Sunscreen in your 20s, you can start retinol, vitamin C if you want to be aggressive with it, or just vitamin C, but definitely start a retinol by your 3rd decade. And into your 4th decade, it will lock your skin in a more youthful appearance. Keep it thicker. A good skincare regimen of like 5 or 6 products will greatly benefit you if you stick to that habit. Let me know in the comments what regimen and what tweakments that you guys do to keep a youthful appearance.